Let's go over electrolyte imbalance, but let's focus on sodium. Sodium ranges from 135 to 145, and it has three jobs. The first one is to keep the blood pressure in the normal range. Then it also helps with the volume, fluid volume, as well as muscle and nerve contractions. When it is low, we call this hyponatremia. And when it is high, we call this hypernatremia. So hyponatremia is caused by three mechanisms. Either you have a low sodium intake, that's one, or too much of a loss, such as through the GI or the renal. For example, here we have diuretics. So if you're taking too much diuretics, it's going to cause the sodium to be excreted too fast. Or if it is being diluted. Now think about it. Let's just say I have salt. Okay, let me draw first this cup. Okay, I have salt right here. And I decide that I'm going to fill it up with so much fluid at the top. What is going to happen to the salt? It is going to be what? Diluted. So we call this dilutional hyponatremia. That's because too much of the fluid is diluting the salt in there. So we have conditions like heart failure and SIADH. Once you know the electrolyte functions, the signs and symptoms start to make sense. So with the blood pressure here, you're going to see hypotension, okay? So with the fluid volume, we are going to see cell swelling because of the low sodium. Fluid starts to enter into the cell. That is why you're going to see some neuro signs and symptoms like confusion or seizures. Then with the nerves and the muscles, think about muscle cramps. Okay, now let's talk about hypernatremia, so too much of sodium. It can be caused by dehydration, okay, so that's the first thing. That is because there is not enough water intake, okay? And then it can be caused by an increase of the salt, not really with diet, but with IV fluid. And the last one is an increase in fluid loss. Don't confuse this with the first one that I talked about, okay? So with this increased fluid loss, that is because the water loss is greater than the sodium loss. So guess what? Just think about this again. This is a cup, okay? We have a lot of salt in here. The fluid was a lot, but let's just say there is a leakage somewhere here that only the fluid can pass. So now all of the fluid will be draining out and it will leave the salt. So here's what we will see. We are going to see a lot of the salt, and then let's say the fluid is right here. So now it becomes what? Concentrated. So now with hypernatremia, we're going to see hypertension. For the fluid volume, we're going to see thirst, brain cell dehydration, because now the fluid is coming out of the cell. And with the muscle and the nerve, you're going to see muscle twitching. And that's it for hyper and hyponatremia.